Since I was in college, I was always a rare disease junkie, as I like to call it. In terms of my relationship with genetics, it is kind of all about connecting these people who feel like they don't have much of a connection with their own local community to a bigger community and to doctors who understand the condition. I envision my career as being a combined primary care pediatrician and a geneticist for kids with very rare disorders, so that it's a one-stop shop of a pediatrician who knows exactly what's going on with these kids.
The medical genetics program at Mount Sinai is one of the largest medical genetics training programs in the country, and we have a very proud history of producing outstanding geneticists who have gone on to play important roles across a variety of fields in genetics.
Being at Mount Sinai, you have the luxury of working with the people of New York City. New York is very diverse and it's a huge population size at your fingertips. So that was one of the biggest draws.
You're going to be immersed in a place that is unlike any other with regards to the learning environment.
From day one, you'll be in a clinic full of patients, learning to interpret plasma amino acids, acylcarnitine profiles, and really understanding how to manage these patients from a nutritional perspective and also from a therapeutic perspective.
At Sinai, you're not only learning the state of the art, but you're also writing the state of the art. We have wonderful basic science, translational science, and clinical trials. The best of the best come here, and it's a privilege to work with all of them.
We offer a wide variety of rotations for pediatrics and adult genetic conditions, metabolic disorders, prenatal genetics, cancer genetics, and laboratory genetics.
The fellowship entails 2 years. The first year is focused primarily on inpatient metabolic and clinical genetics, monitoring the entire child.
The skills that our fellows will learn are how to interpret genetic findings ranging from simple chromosome analysis all the way through looking at a whole exome sequence or a whole genome sequence that comes back on a patient with an undiagnosed disease. People who come into a medical genetics fellowship are typically trained in obstetrics and gynecology, pediatrics, internal medicine, other primary care fields. And so they've gotten an appreciation of human disease.
In the second year, you do more individualized curriculum, particularly 6 months of research.
At Mount Sinai, we emphasize a highly collaborative research environment. Multidisciplinary work is our norm. Translational pediatric research includes investigators in the departments of psychiatry and genetics and genomic sciences, as well as more fundamental studies in the cell, developmental, and regenerative biology department.
I am proud of the recognition of a number of our 15 subspecialties by U.S. News & World Report in its Best Children's Hospitals rankings, and of our research support from the National Institutes of Health that places us among the top 15 departments of pediatrics in United States medical schools.
We have been in the business of graduate medical education since 1924 and currently support an outstanding categorical residency program with a robust research track, 2 combined residencies, triple board and med peds, and 12 pediatric subspecialty fellowship programs.
Some of the things I was looking for in a program was feeling like I was in a small community within the institution where everyone knew my name, where I knew their names, and they were welcoming.